Ever wake up and sense something's off? Maybe your clothes fit looser without any change in diet. A strange ache greets you that wasn't there before, or you find your sheets soaked in sweat despite a cool room. What if those morning changes weren't random and all but your body's way of waving a red flag that something serious, even cancer, could be developing? The reality is that many of us dismiss these subtle signals, chalking them up to getting older or just one of those things. But doing so can mean losing the opportunity to detect an illness early when the odds of successful treatment are much higher. Today, we're going to explore 4 morning symptoms that doctors say could point toward a potential cancer risk. Some of these might surprise you, and others might be things you or someone you care about have already noticed without realizing their importance. Stick with me through to the end, because we'll connect the dots between these symptoms, explain why they matter, and outline the next steps you should take if you experience them. This is the kind of knowledge that could truly make a difference in someone's life. And if you haven't yet, now's a great time to subscribe and hit the notification bell so you never miss essential health insights like this. Let's get started. Number 1. Ongoing cough or persistent hoarseness. A cough that refuses to go away, or a voice that stays hoarse for weeks, is not something to ignore, especially in older adults. While seasonal changes, allergies, or mild infections can cause temporary irritation, symptoms that linger beyond 3 weeks may signal a more serious underlying issue, such as lung or throat cancer. In some cases, this happens when a growth presses against the airways, making it harder to breathe and triggering an unrelenting cough. Because these signs can mimic common respiratory problems, they're often overlooked until the condition is advanced. Hoarseness, in particular, can be a warning that a mass is interfering with the vocal cords or the nerves that control them. Take the case of Samuel, a 74-year-old retiree who noticed his voice sounding raspier over time along with a stubborn, dry cough. Believing it was due to the Harmattan season, he delayed seeking medical help. When he finally went for a checkup, scans revealed a tumor in his upper lung region, affecting both his breathing and vocal function, something that could have been caught earlier. The truth is, persistent coughing or voice changes are not just inconveniences. They can be the body's way of sounding an alarm. If you experience these symptoms for more than a few weeks, particularly if they're getting worse, schedule a medical evaluation without delay. In many cases, early detection opens the door to treatment options that can significantly improve outcomes and quality of life. It's also worth noting that certain risk factors, like a history of smoking or prolonged exposure to dust, chemicals, or polluted air, can increase the likelihood that these symptoms are linked to something more serious. Even if you've quit smoking decades ago, the damage to lung tissues and the respiratory system can linger, making vigilance essential. Finally, staying aware of your body's patterns is key. Keep track of when your cough began, any changes in its severity, and whether it's accompanied by other issues such as unexplained weight loss, fatigue, or chest discomfort. Sharing these details with your doctor can help in forming an accurate diagnosis and starting the right treatment early, potentially saving your life. Number 2. Constant morning exhaustion that sleep can't fix. Morning should be when your body feels restored, ready to take on the day with more energy than the night before. But if you wake up just as tired, or even more worn out than when you went to bed, it's a signal something might be wrong beneath the surface. Doctors warn that ongoing morning exhaustion, despite getting a full night's rest, can be an early warning sign of serious health problems, including certain cancers. This kind of fatigue is not the same as feeling tired after a late night. Cancer-related fatigue is deep, relentless, and doesn't improve even after long hours of sleep. It often occurs because the body is channeling energy toward fighting disease, leaving little for normal daily activity. Blood cancers like leukemia and lymphoma are well known for causing this effect, as they interfere with the production of healthy red blood cells, leading to anemia, a major driver of constant tiredness. Other cancers, including lung, liver, and colon cancer, can also trigger systemic inflammation, disrupting normal sleep patterns and creating a persistent sense of exhaustion. The problem is that many people mistake this for aging or stress, allowing the condition to progress undetected. When prolonged morning fatigue is accompanied by dizziness, appetite loss, or unexplained weight changes, it should be taken seriously. Take the real-life case of Robin Roberts, the Good Morning America host, who spoke openly about her early symptoms before being diagnosed with myelodysplastic syndrome, a rare blood disorder often linked to cancer. She described waking up each morning feeling completely drained, no matter how early she went to bed. Initially, she attributed it to her busy work schedule, but the fatigue worsened until simple activities became exhausting. It was only after medical tests that her condition was discovered, allowing her to get life-saving treatment. If you find yourself waking up tired for weeks on end, keep track of how long it lasts and whether other symptoms appear. Don't brush it off as just getting older. Early detection can make the difference between effective treatment and late-stage diagnosis. Lifestyle factors like poor nutrition, dehydration, or undiagnosed sleep disorders can worsen fatigue, but even if you suspect these, it's wise to see a doctor to rule out more serious causes. Your body's constant morning exhaustion is not something to ignore. It's often your first line of defense in catching illness early. If you've stayed with me this far, drop number 2 in the comments so I know you're still tuned in. And don't forget to subscribe and turn on notifications. Your health is worth every tip you can get. Now, let's continue. Number 3. Sudden, unexplained night sweats that leave you soaked by morning. Waking up drenched in sweat now and then might seem harmless. Maybe you think the room was too warm or your blanket too heavy. But when these sweats happen often, even in a cool environment, and leave your sheets and clothes soaked, it's a sign your body may be battling something far more serious. Medical experts warn that ongoing, unexplained night sweats, especially when they persist for weeks, can be linked to certain cancers. Blood cancers such as lymphoma and leukemia, as well as hormone-driven cancers, are known to cause them. These sweats occur because cancer can disrupt the body's temperature control system. The immune system, in its effort to fight abnormal cell growth, triggers inflammatory responses and fevers that peak during sleep, resulting in excessive perspiration. The challenge is that many people dismiss the early stages of this symptom. They might attribute it to stress, menopause, medication side effects, or aging. What separates cancer-related sweats from the occasional warm night is their severity. They're intense enough to require changing clothes or bedding, sometimes more than once a night, and they come back again and again without obvious reason. One real-world example comes from Andrea Hutton, a breast cancer survivor and patient advocate, who shared her experience in interviews. She noticed severe night sweats long before her diagnosis, waking up multiple times drenched despite sleeping in a cool room. Initially, she assumed it was related to hormonal changes. It wasn't until she experienced additional symptoms, unexplained fatigue and weight fluctuations, that she sought medical advice. Tests revealed early-stage cancer, and because she acted quickly, she was able to begin treatment before it progressed further. If you experience frequent, drenching sweats without an apparent cause, don't shrug them off. Keep a record of when they occur, how intense they are, and whether they're paired with other signs like weight loss, fevers, or fatigue. These details can help your doctor pinpoint the cause faster and improve your chances of catching a serious condition early. Also, be aware that environmental factors like alcohol consumption, certain medications, and untreated infections can contribute to night sweats. However, if you've ruled out these possibilities and the problem persists, it's time for a professional evaluation. Listening to these subtle but persistent signals could make the difference between early treatment and a late-stage diagnosis. If you're still watching, type number 3 in the comments so I know you made it this far. And if you haven't already, hit the like button, subscribe, and turn on the notification bell, because the next tips could be the ones that help you or someone you love catch a deadly disease in time. Number 4. Unexpected morning weight loss that you didn't plan for. Noticing your clothes suddenly hanging loose in the morning, or seeing the scale drop without any change in your diet or activity, might feel like a pleasant surprise at first. But medical experts caution that unplanned weight loss, especially when it becomes obvious in the morning before eating, can be an early red flag for cancer and other serious illnesses. While it's normal for the body to burn some calories during sleep, rapid or unexplained weight loss means something is forcing your body to use more energy than it should. This often happens when the body is fighting an illness. Pancreatic cancer is one of the most notorious culprits, as it interferes with digestion by reducing the enzymes needed to absorb nutrients. When nutrient absorption declines, weight loss, muscle shrinkage, and morning weakness can quickly follow. Digestive cancers like stomach or colon cancer can also disrupt the body's ability to process food effectively, leading to sudden metabolic changes. But weight loss isn't limited to digestive system issues. Lung cancer, lymphoma, and advanced prostate cancer can trigger the release of inflammatory chemicals called cytokines, which speed up metabolism and break down both fat and muscle tissue at an alarming rate. Doctors warn that losing more than 5% of your body weight within a month without dieting or increased exercise is cause for immediate investigation. Many older adults dismiss this as just getting older, but the truth is, any significant, unintentional drop in weight should be treated as a potential warning signal. One real-life example is Valerie Harper, the Emmy-winning actress best known for her role as Rhoda. Before her lung cancer diagnosis, she reported noticing unexplained weight loss despite maintaining her normal eating habits. At first, she assumed it was stress, but as the weight continued to drop and fatigue set in, she sought medical attention. This decision led to an early diagnosis and treatment that extended her life far beyond initial expectations. If you see the numbers on the scale dropping without effort, especially in the mornings when your body is at rest, it's worth tracking. Write down your weight changes, even if they seem minor, and bring the record to your doctor. This small habit can help detect a problem before it becomes life-threatening. Also, be mindful that other conditions like thyroid disorders, diabetes, and chronic infections can also cause rapid weight loss. The key is not to self-diagnose or delay. The earlier you identify the root cause, the better your chances for a full recovery. If you're still watching, type number 4 in the comments so I know you made it this far. And don't forget to like, subscribe, and turn on notifications. The X insight could be the one that helps you or someone you love spot a deadly illness in time. Mornings can tell us more about our health than we realize. Subtle changes like unexplained weight loss, unusual shifts in blood or urine, ongoing pain, deep exhaustion that sleep can't fix, or a stubborn cough and hoarseness can sometimes be our body's early warning system. While these signs don't automatically mean something as serious as cancer, they should never be brushed aside. When symptoms linger or intensify, it's a signal to get checked by a medical professional. Early action can make all the difference in catching illness while it's still treatable. Our bodies have a way of whispering before they start shouting. Paying attention to these whispers, those small but persistent changes, can give you the chance to address problems before they grow into something more dangerous. For older adults especially, regular checkups combined with self-awareness can go a long way in maintaining independence, strength, and peace of mind. Taking care of your health isn't just about avoiding sickness, it's about staying informed, staying ahead, and making choices today that protect your tomorrow. If anything we've discussed rings a bell for you, don't wait until it gets worse. Book an appointment with your healthcare provider. Explain exactly what you've noticed and get a clear diagnosis. Your health is too valuable to gamble with. We'd love to hear your thoughts. Share in the comments one thing you've learned from today's discussion and how you plan to use it. Your stories and experiences not only motivate us but also help others who may be going through something similar. If you found this video helpful, please take a moment to like, subscribe, and share it with someone who might benefit from this information. Every bit of support helps us keep creating content that informs, inspires, and empowers you to live your healthiest life.